For people living with HIV, stigma in healthcare is still a barrier to accessing care. A new advocacy campaign from Casey House is aiming to change that. Here's a look.
At first I was afraid, I was petrified. I knew the science but was scared. I was shook inside. But then I took a pill, researched all night long, and I grew strong. And I learned how to carry on. I'd stigmatize.
Dr. Ed Kacharski is the Chief Medical Officer at Casey House. He joins us with more on this campaign. Welcome back to Your Morning.
Thank you very much for having us.
Good to have you here. Okay, we saw the little package there. What is Stigmavir, and tell us more about this campaign.
So Stigmavir is actually a fake drug that we've created at Casey House, and really it's used to draw attention to healthcare workers who may have not learned about HIV and that they may be actually causing stigma or causing harm to some of our patients. And we really want to use this as an opportunity to educate them, to reduce stigma for our patients and our communities.
I guess we don't think about that, right? Like, you know, there's been so much education and so much public information around HIV. I wouldn't think that stigma exists in the healthcare realm.
I think that we have done a lot in terms of education, but I think we could have done a little bit better. I think we have to have people unlearn their fears of HIV. And so we see sometimes when our patients go see providers, they may be refused care, which is awful. They may also just have these microaggressions, so that sort of nonverbal communication of them, you know, a provider stepping back once they learn that they have HIV, or wearing gloves when they don't need to, or even just pumping hand sanitizer when it's totally inappropriate.
And these are things that are happening on the day-to-day. Why aren't healthcare providers getting the information that they need or the ability to unlearn, as you say, some of those fears?
I think that's a fantastic question. I think because there was so much fear with HIV when it first started in the 80s and 90s, that kind of just really struck a chord with people and put something in people's brains that they've had a hard time forgetting. And I think sometimes in medicine, we forget about the successes and the triumphs, and that we have effective medication for HIV. People can live just as long with HIV, in some cases longer with just one pill once a day. And for the vast majority of people with HIV, they're very well controlled and they're untransmittable, meaning that if you're involved in intimate contact with people with HIV, you won't get the virus.
So nothing gets people's attention like an amazing song, especially when it's an adaptation of Gloria Gaynor's I Will Survive. It's so great. I want to ask you about it, but first I want to play a little bit more.
I treat all my patients just the way I should.
Now I use my kindness for the greater good. People
I'm just imagining you and your colleagues singing and dancing to this over at Casey House.
That's right. We're not in the commercial itself because we want it to be more of a success, but we are practicing the dance. But who doesn't love like a commercial parody of a medication or drug like they do on Saturday Night Live?
Yeah,
And
I love it.
we've really taken this opportunity to kind of call in healthcare providers, not to shake our fingers at them, but to make it a little bit more fun, but also demonstrate people with HIV can dance, have joy, and are just like you and me.
And I will survive.
Well,
the HIV stigma-free logo, also part of this ad. So how should healthcare providers use it? So we're looking at that symbol there. It's not a fully complete heart. What does that mean? What does that symbolize?
It symbolizes your organization's commitment to providing stigma-free care. And you can learn more about it at stigmavir.ca. We have a whole toolkit for healthcare providers there. And you can actually download that icon to put on your webpage, but also a physical one to put on your office as well.
While I've got you here, sort of the last thing that you would like to say to people when we're talking about unlearning fears, what's something that you want people to take away from today?
I would say that really listening to our patients is probably the most important thing you can do, their experiences. And being able to do that requires you to have a stigma-free environment. And I think knowing our patients the best way possible gives them the best care.
I'm going to be singing that song for the rest of the day. Dr. Kacharski, thanks for stopping by Your Morning.
Thanks, Anne-Marie.
All right, and a reminder, if you want to learn more about this campaign, you can go to stigmavir.ca.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.